much. Good afternoon, everyone and partners, and welcome to this program. I'm Sam Taveras, and I'm the Associate Director for Partnerships here at the Centers for Disease Control and Prevention's Office for State, Tribal, Local, and Territorial Support, better known as OSTLTS. I will be serving as the moderator for today's quick chat with Dr. Montero. I will take a few minutes to discuss the background of the Public Health Law Academy, then introduce Dr. Montero, who will describe the Academy and the easy-to-use online trainings that it offers, and how it can help advance the competencies of the public health workforce. Slide 2. We always start our presentation with a disclaimer, which notes that the contents of this presentation have not been formally disseminated by the Centers for Disease Control and Prevention and should not be construed to represent any agency determination or policy. Because we're talking about law and legal tools, I would also like to note that these presentation materials are for instructional use only and are not intended as a substitute for professional legal or other advice. Always seek the advice of an attorney or other qualified professional with any questions you may have regarding a legal matter. The Public Health Law Academy is a core project of a cooperative agreement between CDC and ChangeLab Solutions. The CDC unit responsible for working with ChangeLab Solutions on developing the Academy is the Public Health Law Program here in OSTLTS. So the mission of the Public Health Law Program is to advance the use and understanding of law as a public health tool. It provides training and technical assistance to state, tribal, local, and territorial jurisdictions on how to use law to improve health outcomes. When the Public Health Law Program contacted us in the Partnership Support Unit about the opportunity to moderate this chat, we were eager to help. We want to spread the word about the Public Health Law Academy because it is one of the products developed under a cooperative agreement managed by our unit. The purpose of the cooperative agreement is to build the capacity of state, local, tribal, and territorial health departments to effectively use evidence-based legal and policy strategies to improve health outcomes throughout the nation. But the Public Health Law Academy project reaches deeply into a major purpose of the entire cooperative agreement, namely providing educational resources and training to the public health workforce to build its capacity to use the tools of law and policy to improve health outcomes. So ChangeLab Solutions is in Oakland, California. They are a nonprofit organization that works with partners along the health spectrum to create innovative laws, policies, and legal tools that aim to ensure everyday health for everyone. Together, CDC's Public Health Law Program and ChangeLab Solutions have created the Public Health Law Academy with a goal of providing tools that will give the public health workforce a basic understanding of the use of law and policy to improve public health outcomes. After a quick introduction of Dr. Montero, I'll pass the mic and allow him to tell you more. So Dr. Jose Montero, who's sitting next to me, serves as the Deputy Director of the Centers for Disease Control and Prevention, responsible for overseeing support to the U.S. health departments, tribal nations, and insular areas, and as the Director of CDC's Office for State, Tribal, Local, and Territorial Support. Previously, Dr. Montero served as Vice President of Population Health and Health Systems Integration at the Cheshire Medical Center, Dartmouth, Hitchcock, Keene. Dr. Montero also served as Director of the Division of Public Health Services at the New Hampshire Department of Health and Human Services, Chief of New Hampshire's Bureau of Communicable Disease Control, and Deputy Director for Public Health Emergency Preparedness and Response, and State Epidemiologist. He also served as a State Epidemiologist. So Dr. Montero holds a medical degree from the Universidad Nacional de Colombia, an epidemiology degree from Pontificia Universidad Javeriana in Bogotá, Colombia, and a master's degree in healthcare delivery science from Dartmouth College. Slide 7. So at this time, Dr. Montero, the floor is yours.
Thank you very much, Sam. Thank you, everybody, for joining us today for this free on the Public Health Law Academy. When we think about this, why do we do this? Well, the answer is quite easy. We cannot really do public health if we are not looking at regulations, if we are not looking at law. From whatever legislation in our states or at the federal level creates our organizations, health departments, local health departments, or many of the other partner organizations, we see the role of law as done by statute, or other things that impact the health of the public, like the Clean Indoor Air Ordinance. So it's through law that we actually create the framework that helps make the healthy choices the norm. And that has been quite an important concept as we look at how we better develop public health, or as how do we move into the public health of the future, creating that right environment. So you are in the field. You know that it's hardly any public health challenge today that can be resolved without some contribution of our legal systems or policy solutions. So as an example, there are so many laws that have to deal with public health practitioners and immunizations. Every state has a different system, a different approach, different vaccines that are mandatory. We have federal regulations about it. We have payer systems and healthcare delivery regulations, many of them based on law. In fact, we know that many of the public health actions of today started with Jacobson in Massachusetts many years ago. So public health law is paramount to everything that we do as a public health agency. It does impact what we do in every type of emergency. Isolation and quarantine are basically public health constructs that are implemented through application of law. The things that we have done to change other measures, other control measures, distribution of vaccines, our own police powers as public health authorities are a piece of law. So, oh God, I start coughing as soon as I start talking about smoking, which is quite telling because we need clean air. We need regulation to help us prohibit smoking in multi-unit housing. And that is the way that we have been able to improve the quality of life for many people who live there, not just those smoking, but help us impact many chronic conditions, asthma, so on and so forth. So that is what actually helps us as well to create access to healthy housing. And housing, as we all know, is one of the key social determinants of health that we all in public health strive to improve. When we look at the 10 essential services, we can go one by one and realize the role of health on those. You see, monitoring health, we cannot have surveillance if we don't have the laws that tells us what conditions we do surveillance for, regulate, and report, and which ones do we report. And that goes from the local level to a worldwide component, where even we as the U.S. have to adjust our list and the way that we define diseases a couple of years ago to comply with WHO reporting. So you see law playing a key role there. If you go in that clock around, clearly you see that, well, number 5 is developing policies and plans. But then we have to enforce them. And we know that we do that in many different things, led or regulations that license facilities, the quality of the services that are provided, and the type of providers that we have as we look at how do we ensure a competent workforce in number 8. Clearly, evaluation, the effectiveness of laws is something that we need to start measuring, that we need to improve the way that we measure more and more as we move forward. What is the impact of those regulations? How are they impacting and assessing and in the assessments of quality of life of the populations we serve? So looking at this from a structural and systemic perspective, CDC and its partners, when accreditation was developed as a voluntary system, with our partners, we said, well, Domain 6 will talk about understanding and enforcing public health laws as one of the things that we do expect, as one of the standards that we do expect health departments to have. And you read that there at the bottom of the slide. We need to figure out how to do ongoing education of individuals and the organization, the meaning, purpose, and benefit of public health laws, and how to comply with them, not just for the others, but internally in our own organizations. So Michael Bloomberg, former New York mayor, said it quite clearly. You can read his quote, but basically, and I know he's a lawyer, so he has to say things like this, but I am not. And I do agree with the quote. Law is what really makes things work. It is what is behind each one of our actions, and we almost always refer to our public health authorities. Well, those are the law. So if we want to decrease injuries, we look at a seatbelt law. We look at helmet laws, even though in my state, when I was the health officer, we could never pass the helmet law. But that's what makes us quite an interesting country, our federal system. Fluoridation of water, that many public health advocates, the Kims, that believe that is so clear, and we still don't have laws across the country doing that. Inspections of meat. So it goes all over the spectrum of services that we provide, care for, or make sure that are available at all levels. Which brings us again to what we are presenting to you today, which is for our public health practitioners at the federal, state, or local level. This great research that will allow us to help better integrate what we do and get a different and better understanding of where we start as we look at policies. So to help address this problem, so we have the Public Health Academy, which is the product of the collaboration between our Public Health Law Program and ChangeLab Solutions, where they spent close to 4 years developing it to the stage that we can show this to you today. The strategy here is to infuse the public health workforce with improved competencies and confidence, and the information that is needed to use legal and policy tools in evidence-based strategies to improve population health outcomes. As I just mentioned earlier, we have done this internally here and with our partners as well, making this one of the standards that agencies should meet for accreditation. The services, the wide array of services provided under this project is specifically designed to provide powerful and new resources to both the public health agencies and actually the non-governmental and community-based partners, and increase the working relationships between public health practitioners and their attorneys. When we look at the public health of the future, we know that this is about partnerships, internal and external. The way to have those partnerships to be successful is to share a baseline of knowledge and understanding of the different things that we are doing. Those training resources are going to be available online and on demand and free, which is always important to remind to everybody. The team is using the CDC-branded version of the Public Health Foundation Train platform as the primary vehicle for reaching the target audience. Again, we are building in successes and other vehicles that we have. So public health practitioners are quite familiar with Train across the country. Hopefully health system partners are. If not, they will increase their level of knowledge. This will bring this subject matter expertise area to all levels of government and our system partnerships. So the current Public Health Law Academy training series has 9 trainings that are clustered around 3 topics. You can read the titles of those clusters in the slide. So the introduction, the hot topics, and the legal epi. So when we talk about public health law introduction, we want basically to explore what we have been in general talking about. What's the role that law plays in everyday public health? To answer these questions, we have the classes that listed here: public health law, past and present, preemption and public health, and structure of government. We hope that through these trainings we can answer questions such as what's the history of public health law? So do we all understand where Jacobson came from and why it was such a seminal judgment and how it still plays in today's world? How do we public health practitioners balance the common good against the rights of affected individuals? So where is the limit of our police powers? How do we exercise those and where they come from in emergency preparedness? How do we balance the power of government? And how and where does the citizens have the right to come and challenge and look at different processes so as that way we can serve them better? So clearly these trainings and with those comments you realize that this is by design transdisciplinary, because that's the nature of public health practice. And we hope to provide the tips to use this information to improve everyday practice, not just the public health law, but to use the law as the tool to improve that practice. Now, law, as everything in public health, is never static. It's always dynamic. It's always evolving. The developers of this clearly look at that and thought about, okay, how do we look at natural disasters? What is the emergency of the day? How do we look at the things that are going to impact us in the foreseeable future, such as healthcare shortages or even the opioid epidemic? So these hot topics, as they are called here, are things that our first responders and public health practitioners keep asking us. So how do we react? I did ask those questions in my role previously before I came here. So how far does my authority go in a public health emergency? How can we manage a community when we have a really severe flu pandemic? What is the community distancing and what are the authorities for that? So this type of things are answered in the different classes. I am using the word classes, but they are not classes. Courses that you see here. So public health threats and the U.S. Constitution, legal approaches to reducing prescription drug overuse, and this last one that will come in the spring of 2018, so we are kind of going ahead of ourselves here. But we are so excited that we want to share with you that we're going to have a guide to pharmacy collaborative practice agreements, which is such an important topic as we look at today's opioid events. And then the final cluster has to do with the overview of legal epidemiology. Maybe most people in the phone really know what this is, but as a defined field of study, it's relatively new. We define it as a scientific study, we, meaning the experts in the field, not me, scientific study and deployment of law as a factor in the cause, distribution, and prevention of disease and injury in any given population. Our legal epi trainings are for public health practitioners interested in studying the connection between these laws and public health. This is a well-known example. We have been talking for years about the difference in life expectancy by zip code. Why is that? This map that you have here in the slide is California, Highway 99, I think. You see when you look at the different exits, a drop in 12 years life expectancy between a couple of different exits. So normally we look at this and say, oh, epi, so people here is younger, people here is older, people here is poorer, people here is there. But actually when you think about this is a perfect question for epi, for legal epi to help answer, because legal epidemiology investigates how different in the system of enforcement of certain laws affect health. So when we go back to that map, Merced County law may include regulations about smoking or road safety or clean water, while Fresno County law may not. Maybe Merced County and Fresno County have the same ordinance, but they enforce them differently. So when you start to think about this, and normally we EPIs look at this as risk factors, well, the risk factors are conditioned by the environment, which takes us back to one of the points that I made earlier. Law is the tool that we use to create the environments that make the right choice the automatic choice. So you see here how looking at law from that EPI perspective allows us to have a partner that will help us build this field and improve the outcomes of the populations that we serve. So, Introduction to Legal EPI, available in November of 2017 as legal mapping, and the evaluation will come later next year. So that is under early development. So when you see this product, you're going to realize that it's easy to use. You can do it on your own time because it's online. And they are essential not only for lawyers, but to build the transdisciplinary teams that we need. So this should be for all health professionals, as the accreditation standard recommends. So wanted to highlight this. I'm quite happy and proud to present this product as part of CDC tools for the field. Certainly this coming out of our public health law program here at the Office for State, Tribal, Local, and Territorial Support is quite important for all of us. And want to put it out there for your use. Let us know what you think about it when you have the chance to look at it. So thank you very much for your attention. Help us disseminate the message. Those of you who may come to APHA will say it, but if you aren't, please look at these slides that we used today and the links there and go through it. It is a really great opportunity. So thank you to you in the audience. And Sam, back to you.
Okay, well, thank you so much, Dr. Montero. You have shared very, very valuable information for our participants and our partners. And to our partners who joined us today, thank you. We hope you benefited from this exclusive preview of the Public Health Law Academy. I also add that the Public Health Law Academy will have a booth at APHA, so hopefully those of you that are participating can visit and get and obtain more information. So if you have any questions about the Academy or suggestions for future curricula at the intersection of public health and law, please feel free to reach out to CDC's Public Health Law Program at phlawprogram@cdc.gov.